The best way to improve dependence interventions is to treat the cause and the symptom. This is what symptom-based models look like. They are based on symptoms. That means most of the population down here is, as indicated in the model, no intervention. If there's enough symptoms, there's a brief intervention, and if there are enough symptoms, then there's a brief intervention referral to treatment. It kind of makes sense until you look at this prevention paradox idea that says most of the hospitalizations and most of the accidents and deaths happen in the 75% low risk with very few symptoms. That's a big problem. The next problem is the 20% high risk that we know is there look invisible until we catch enough symptoms at one time. They look low risk, but they're not. And they believe they're low risk, but they're not. And the low risk people believe they're low risk, and that's dangerous. And then, of course, a minority of the population will display severe risk symptoms, and they will be treated far into their disease process, which is the best we can do with what we got, but we have to do better. So because of population, the acute accidents are going to outweigh the chronic ones. The acute deaths will outweigh the chronic ones. So what are we telling everybody? Well, we treat them and we point towards low-risk guidelines that are symptom-based, whether it's prevention or treatment. These have been around for many years. Here's another one. Most people recognize this kind of thing. So what happens over time? Well, nothing. We have 75% that are low risk that are going through the prevention paradox, 20% are high risk, and 5% are severe risk. And this is our treadmill. This is our dependence factory. Are we doing some good? I'm certain that we are, but how much? Nobody knows. And how much better can we do? Nobody knows that either, but we're about to find out. This is cause-based treatment. What I found out in my research with prehab is the cause of addiction is mistaking a dependent risk-response pattern for an autonomous pattern. This is the difference that I found between most students in the population I was studying and the students that had severe symptoms or recovering or recovered from severe symptoms. So instead of talking about a symptom-based education program, prevention program, and treatment program, we get to talk about what to do with your own risk response process, how to self-assess that, and how to understand others, or how not to misunderstand others. It's also a way to identify the invisible. Once you can show someone's process to themselves, they can start to lean towards autonomy rather than dependence. And once you show the dependent people that are already dependent, they can start to make the kind of commitment and to meet the challenges of recovery. This is called an empowerment model because it puts the power right in the client. The client has the power. They just have to see what the attributes of their risk response system looks like and the power of the order of those attributes. Sounds complicated. It's very simple. A lot of work's been done on it for many, many years in marketing, sales, politics, communications, all that kind of thing. It's way past time we apply it to our most precious resource, our youth. So no matter where a student is on this continuum, and no matter who he knows who is on this continuum, they can start to develop an idea of where they are, where the other people are, in spite of any genetic or environmental influences, which is autonomy. Because students can self-assess, this is measurable. We have an instrument. Prehab is an instrument that measures risk response order and risk response systems, so we can see what happens after we run a sample through prehab. It looks like this. When we identify and intervene on the 20% and move them to low risk and educate the low risk, we start to have a model that looks like this. This is amazingly consistent. And we reduce a lot of the severe to what's now a very small high-risk group and a very small severe risk group. And that's the idea. Take a time, look at the slide. If you're interested, go on over to www.prehabmap.com. These are the actual program is no charge. It's on YouTube. You just look at it, show it to anybody. You can charge to present it, but the resource itself is no cost. Here's some of the information, and I'll put some more information in the link around this particular video wherever I post it. So it is possible to improve our interventions and prevention and treatment by treating the cause and symptoms. Thank you for your time.